Hi, welcome back. Today we are going to see an important topic, that is acid-base balance. It is a very high yield topic and I am going to teach you in a very easy way. So let's go into the topic. What is acid-base balance? It is a balance between the acids and the bases in the blood. Yeah. There is different types of body fluids where it is having different types of acidity and alkalinity. So there is a balance in this particular fluids in our body to maintain the particular pH that is in our body. The normal pH, what we always say is 7.35 to 7.45. This is the most essential pH to maintain the body and to make the body to stay healthy and to maintain a homeostasis in our body. If the pH is less than 7.35, it is a condition called acidosis. If the pH is above 7.45, it is alkalosis. Here the main NCLEX tip is, if the pH is 7.4, it is normal, and if it is below, that is 7.4, below it is acid, and if it is above, it is base. There are three important values in an ABG. So we have to see those values in an ABG strip. That is, if the pH is 7.35 to 7.45, it is normal. And this is the first thing we need to see. And next is partial pressure of CO2, that is PaCO2. We are going to see the value, it should be between 35 to 45 mm of Hg. It is the same value from the pH, that is 7.35 to 7.45, where 35 and 45 we can remember in the same fashion for PaCO2, that is 35 to 45 mm of Hg. It is maintained by our lungs. And next one is the bicarbonates. The value is 22 to 26 milliequivalents per liter. It is maintained by our kidneys. And the easy memory trick is Rho, that is respiratory opposite and metabolic equal. Okay. So we are going to see the respiratory problems. That is, it is controlled by the lung, that is the CO2. That is, CO2 is equal to the acid. If the CO2 is increasing, then the condition is called acidosis. If the CO2 is decreasing, the condition is called alkalosis. Here there are two types of problems, that is mainly the respiratory alkalosis and the respiratory acidosis. In respiratory alkalosis, the pH is increasing and the CO2 is decreasing, and the causes mainly here are anxiety, hyperventilation, pain, fever, and the patient will typically present with signs of fast breathing, dizziness, and tingling fingers. These are the main signs of respiratory alkalosis. Now coming on to respiratory acidosis, the pH will be less, that is 7.35 and less, and the CO2, carbon dioxide, will be on the higher side. The main causes of such problem is the COPD, chronic obstructive pulmonary disease, asthma, and opioid overdose or a hypoventilation. And the patient's signs here is slow breathing. Next, coming on to the metabolic problems, it is mainly the kidney which controls the bicarbonates. Here, bicarbonates is equal to the base. If the bicarbonates is increasing, then it is called alkalosis. If the bicarbonates is decreasing, then it is called acidosis. So there are two main problems here again, the metabolic acidosis and the metabolic alkalosis. In metabolic acidosis, the pH is decreasing, the bicarbonates is also decreasing, and the causes mainly here is decay, that is diabetic ketoacidosis, the diarrhea, the renal failure, sepsis. The patient is typically presented with deep, rapid breathing, mainly the Cosmol type of breathing, weakness and confusion is present in patient. And the another main type of problem is metabolic alkalosis. Here the pH is an increasing trend. Similarly, the bicarbonates is also increasing. The cause here is the vomiting, the NG suction, the antacids, the diuretics. The patient mainly presents with muscle cramps and slow breathing and irritability. The four types summary is very important, where we are going to summarize in one slide, that is Respiratory acidosis, the pH decreases, the carbon dioxide increases, and the bicarbonate may remains normal or it gets elevated. In respiratory alkalosis, the pH increases and the carbon dioxide decreases, and the bicarbonates may stay normal or decreasing. And the metabolic acidosis, the pH decreases and the carbon dioxide also decreases and the bicarbonate also decreases. And where in case of metabolic alkalosis, the pH increases and the bicarbonate also increases and the carbon dioxide is also increases or normal. This table is very much high yield in NCLEX. The 4 easy steps what we have to interpret in an ABG is, first is the first step we are going to look at the pH. Yes. Then we are going to look at the carbon dioxide, and step 3 is we are going to look at the bicarbonates, and step 4 we are going to see whether there is any compensation. So I am going to tell you about the compensation in the next slide. Compensation is a simple version. How we are going to see is, if there is a lung problem, the kidney will try to fix it. Yes. And if the kidney is the problem, the lung will try to fix it. It means both are helping each other to compensate their problems. If the pH is normal but the carbon dioxide and the bicarbonates is abnormal, it means already the compensation has taken place. Yes, this is all about today's small topic about this acidosis and alkalosis and acid-base balance. I hope this has given you some knowledge regarding this. Thank you and happy learning. Have a good day.